Hello and welcome, my name is James Dearden and today's video is about inspiratory muscle warm-ups and the controversies surrounding them. Within this video I aim to introduce warm-ups and inspiratory muscle warm-ups in particular, and will also critique previous controversial research in the area. So what is a warm-up? A warm-up is intended to improve a muscle's dynamics to prevent injury and to prepare the athlete for the exercise's demands. Warm-ups have been shown to be effective in a study by Hajoglu et al. In 2005, who found that 3-kilometer cycling performance is significantly improved by the inclusion of a warm-up. There are different types of warm-ups. A passive warm-up involves raising muscle or core temperature by external means, for example using a bath or a shower, whereas an active warm-up involves heating the body through movement, such as running or cycling. It is also important to stretch in a warm-up, and this can be done dynamically or statically. To stretch dynamically, you need to add movement to the stretch, such as doing forward lunges, whereas static stretches are on the spot. However, Yamaguchi and Ishii found that dynamic stretching enhances muscular performance. However, it must be added that they did find that static stretching did not significantly decrease muscular performance. More specifically, what is an inspiratory muscle warm-up? An inspiratory muscle warm-up prepares the respiratory muscles such as the diaphragm and the internal intercostal muscles for exercise, and this is something that is usually overlooked. This is performed using a power breathe, which is a pressure threshold loading device. It involves a person breathing in 30 breaths twice with a rest of 30 seconds at 40% maximal inspiratory mouth pressure. There's a lot of research surrounding this area, however, it supposedly enhances performance when used prior to exercising, as found by Voliantis, Tongfu, and Lomax. Moving on to the first of the critiqued studies in this current area, Voliantis et al. In 2001 aimed to compare the effect of 3 different warm-up protocols and to identify the functional significance of the respiratory warm-up. Starting with the methods, they used 14 competitive club rowers, 7 of which were male. They had 2 familiarization sessions and 3 warm-up conditions. The experimental overall test used was a 6-minute all-out rowing performance on a rowing machine. The first of the warm-up group conditions was a submaximal rowing warm-up, abbreviated as SWU. This involved 8 minutes of submaximal rowing at 65 to 70% of the maximum, with stroke rate at roughly 22 to 24 strokes a minute. This was followed by 3 minutes of rest before the 6-minute all-out performance was completed. The second of the groups was a specific rowing warm-up, abbreviated as RWU. This involved 5 minutes of light treadmill jogging at 110 to 130 beats per minute, followed by 10 minutes of stretching. And then it also included 12 minutes of gradually increasing intensity, with the heart rate to increase from 148 to 178 beats per minute, followed then by 5 sprints with 2 minutes of light paddling between each sprint. The 5 sprints had increasing stroke rate and power outputs throughout. Following the sprints, participants were allowed 5 to 7 minutes of rest. The final group was a specific rowing warm-up plus respiratory warm-up, abbreviated as RWU+. This followed the identical procedure to the RWU group, however 2 sets of 30 breaths were completed at the end, and this was done on a power breathe at 40% MIP. The overall findings of this study were that following the RWU+ group, MIP, power output and distance covered all increased, and inspiratory fatigue and perception of dyspnea, which is related to difficulty in breathing, all decreased. Therefore, the overall finding was that respiratory warm-up has a significant impact on rowing performance. However, this study came with its limitations, as the SWU group completed 8 minutes of warm-up exercise, whereas RW and RW+ completed almost 20 minutes of warm-up exercise, as well as stretching. This could have affected the results due to the fact that the longer warm-up could have caused the muscles to be more ready and prepared for the exercise task ahead. And also, there was less rest provided for the SWU group, which could hinder performance as they may not have fully recovered from the warm-up exercise prior to the test. Moving on 5 years, Tong and Fu in 2006 aimed to examine the effect of an inspiratory muscle warm-up when added to a whole body warm-up on an intermittent run. They used 10 males and 3 conditions, which were the control, IMWP and the IMW. The overall test used was a 20-meter intermittent shuttle test. The control group involved 5 minutes of treadmill running, 10 minutes of stretching, and 5 minutes of free running on the ground. IMWP and IMW groups followed the same protocol as the control trial. However, an inspiratory muscle warm-up was added between the stretching and the free running. This involved 2 sets of 30 breaths with a short rest on a power breath. To differentiate the IMWP and IMW groups, the IMWP group used MIP at a value of 15% for a placebo effect, whereas the IMW group used MIP at a value of 40%. The warm-ups in regards to the running and the stretching were all self-selected by the participants themselves and were meant to be kept the same for the following trials. Tong and Fu found that MIP, MRPD and trial performance in the IMW group all improved, and in addition to this, rate of perceived breathlessness was significantly lower in the IMW trial when compared to both of the other trials, which suggests that the participants could have found it easier to complete the test after the IMW intervention. The finding of this study also suggests that IMW is very beneficial to intermittent exercise. However, the warm-ups were not standardized, therefore meaning that the participants could have all been prepared for exercise differently, potentially giving some of the participants more benefits than some of the others. Also, as the warm-ups were self-selected, participants may have used static stretches, which, as I've previously said, may not be as effective as dynamic stretches. Finally, the IMW and IMWP trials involved more time due to the addition of the power brief, and therefore this allowed the participants for more time to rest ahead of the shuttle test. Advancing a further 5 years, Lomax, Grant and Corbett in 2011 aimed to analyse whether both inspiratory muscle warm-up and inspiratory muscle training affect intermittent running to exhaustion. They used 12 county standard footballers and had 4 trials. Trials 1 and 2 were 4 weeks of sham or real inspiratory muscle training, and trials 2 and 4 involved inspiratory muscle warm-ups. IMW consisted of 2 sets of 30 breaths at 40% MIP, with 60 seconds of rest between each set. Prior to this, participants were allowed to do 5 minutes of running and 10 minutes of stretching, which was self-selected, but had to be kept the same within all trials. Overall experimental test used was a 20-meter yo-yo test. What was found was that inspiratory muscle strength and intermittent running to exhaustion both increased following the IMW intervention, and therefore this study further supports the findings of the previous 2 studies. However, they used self-selected warm-ups just like Tong and Fu, and therefore, as previously stated, there could be problems within using static stretches. And also, as they chose to run at self-selected paces, each participant could have run at a different pace, therefore preparing their muscles either better or worse than other participants. In addition to this, they also added no trial with only a warm-up without IMW to therefore work as a control group. Most recently, Johnson et al. In 2014 aimed to examine the effects of a validated cycling warm-up protocol with and without the addition of an inspiratory muscle warm-up on 10km cycling time trial performance. They used 10 competitive road cyclists and had 3 conditions, and all trials were standardized at 30 minutes long. The control trial involved a 10km time trial only. The psych trial involved periods of rest as well as 15 minutes of a cycling warm-up, and the psych and IMW trial adopted the same structure. However, the first 8 minutes were used as the time for the power brief to be used. The overall performance test was a 10km cycle time trial. Johnson et al. Found that 10km time trial performance in the psych and psych IMW groups improved by 1.6%. However, they were no different to each other, and it was found that the main benefits of both warm-ups were reported in the first 5 to 7 minutes, as the 2 groups both started at a much higher power output. These findings oppose the previous 3 highlighted studies, and the findings suggest that you only need to do a task-specific warm-up for true benefits when going to exercise. This study provided a much neater and more accomplished experimental design and protocol. However, it could be added that this study used different exercise modalities than the previous studies, and therefore suggesting possibilities in difference in exercise tasks when it comes to inspiratory muscle warm-up. Shown 4 studies with differences in findings in which some agree and some do not. Tong and Lomax's studies both use a self-selected warm-up which could cause differences within the participants and their readiness to exercise, which is a particular negative to their designs. My personal preferences lie within Johnson et al. 2014 study due to the more accomplished study design and protocol. Also, the fact that they added a whole body warm-up without IMW as a control trial was a particular positive. So, why don't you give it a try? Thank you for watching.